chosen to study and discuss the people of Laos. Culturally, Laotians have taken influence from surrounding countries such as Thailand, China, and Vietnam. A substantial influence from much farther abroad is that of the French, and the land was part of French Indochina beginning in the late 1800s until gaining full independence in 1953. A very strong and unique culture. Laotian place much emphasis on one's moral duty, the Buddhist concept of Dharma. They have a strong respect for their elders, family, and the clergy. The population is predominantly Buddhist with the remainder animistic, meaning the belief in traditional spirit that are attached in buildings, places, and the protection of the people. Laotian place enormous value on religion. The majority of males become monks for the proportion of their life. This provides them with the education and the reputable position within society. There are around 254,000 Laotians presently residing in the United States, with less than 5,000 here in the Tampa Bay area. Some of their culture and tradition have understandably suffered from being immersed within other culture, yet many have survived. Laotians are very hospitable, and it's very quite common for them to greet each other with "Kin Khao La Elbo," meaning "Have you eaten food?" Food is venerated and often a topic of conversation both at and away from the dinner table. Some of their favorite dishes including papaya salad, chicken lap, sticky rice, steamed fish wrapped in banana leaves, noodle dishes, grilled fish, meat, and sausage. Though they have customs that differ from us as Americans, they still maintain a strong work ethic, compassion for their neighbors, and the willingness to evolve just as we do. Their link to a still developing society make them an interesting subject for this discussion, and is their young but growing healthcare system. Next, please welcome the next speaker, Cassia.
Okay, next I will be speaking about diseases and conditions. The top illnesses and conditions that affect the Laotian people are ischemic heart disease, stroke, COPD, chronic kidney disease, diabetes, and cirrhosis. Stroke is the leading cause of death among the Laotian people. However, other research has found that ischemic heart disease is the leading cause. Also, heart failure is associated with an increased risk of ischemic stroke. As far as the symptoms go, ischemic heart disease is a silent disease, but it can cause chest pain, fatigue, difficulty breathing, and a feeling of unease. It can also lead to myocardial ischemia, causing a feeling of pressure, pain radiating to the jaw, arm, or the left shoulder, pallor, and diaphoresis. As far as the treatment goes, the common treatment is nitroglycerin, and it is used for vasodilation to improve blood flow to the and relaxation of the heart. Other treatments are beta blockers to relax the heart, aspirin, calcium and ACE inhibitors to relax the blood vessels, and medications to lower the cholesterol. Lifestyle changes are also encouraged in order to better this condition, which includes improving the healthy diet, exercising, and quitting smoking. The success of treatments are the following. Antiplatelet drugs are widely used and are very successful because they lower the circulating cholesterol in the blood, and they decrease the plaque size. The treatment also is dependent on the individual in applying the lifestyle changes in their daily lives. As far as the impact on the person's quality of life, it impacts the quality of life because it impairs their ability to perform the daily routine activities. It also impairs the emotional state as far as bringing anxiety and depression. And physically, the person feels fatigued and they won't be able to perform the activities they once were able to perform before. So now I will present Lonnie.
Hello everybody. Today we're going to talk about the health disparities. According to Pfizer, Asian Americans represent only about 5% of the population in the United States, and within the 5%, they represent more than 30 different countries, and due to the lack of research that often put together, and Laotian Americans are part of this population. Statistically, Asian Americans are the leading cause of death is cancer, followed by cardiovascular disease. 20% are diagnosed with diabetes, followed by 32% diagnosed with prediabetes. And then they represent 50% of the cases of chronic hepatitis B. Based on a data source study done in 2016 in Minnesota, they found that Laotian Americans are at higher risk of developing liver cancer than any other Asian American group. And Laotian adults, the leading cause of death is liver cancer due to chronic hepatitis B. And only 8% of Laotian immigrants actually get vaccinated. And men have a higher risk of developing liver cancer than women due to the fact that they are less likely to get vaccinated and screened. Women are 4 times more likely to get vaccinated and screened, but this might be due to the fact that it's a common practice to screen for hepatitis B for pregnant patients. Disparities for reasons for these disparities include lack of trust and lack of trust and health literacy, and the Western practices. They're more likely to use home remedies within the community, and there are more causes of the disease are more related to a spiritual connection, and they're less likely to seek out preventive measures. Leah is now going to be talking about the spiritual practices.
Hi, my name is Lee. I'll be talking about the spiritual practices. Laotians believe in Buddhists. They also have the option to have a monk present. And when they are your patient, please offer that to them at the beginning of their care. Also, they practice Western medicine as a secondary. They actually use holistic things such as cupping, pinching, and coining. Avoid touching the top of their heads. That's the highest point to them, like it's the temple for them. Also, the Baisi ceremony is for women that give birth to their children, or they have it for other important events in Laotian culture. Also, they believe in homegrown and imported herbs, and they also have elderly and older men and women to do massages, or they do manipulation healers. So they believe in the elderly people as being spiritual providers for them. Also, they wear talisman, which is a piece of jewelry that's given to them by their family, and it's passed down, and it's a spiritual garment for them. And I have a quote from Laotian culture. It says, "Families prefer terminally ill members to return home and die, as it is believed that the soul of a person who does not die at home may wander and not be reincarnated." So meaning that they may be wanderers if they're not at home. So say if someone dies here in Florida and they're actually from Laotian country, then that means that they feel like there's a wanderer and not actually at home with them. Now I am going to introduce Kristen, who is going to do the next segment.
I'm going to discuss the nursing concerns in the Laotian American subgroup. The disparities are low socioeconomic status. The majority of the Laotian Americans make under $20,000 a year, which means that quite a few of them do not have health insurance. And because of this, over half have not seen a primary care provider in the past year. The health practices are very based on herbal practices and more traditional medicine versus the Western medicine that we practice here. So there's a lack of routine physicals and testing, which can cause chronic diseases to not be found until it's too late to do anything about them. A lot of them try to self-treat when they think something's wrong instead of seeing a doctor to figure out what's going on and catch it before it becomes a chronic issue. The endemic conditions like heart disease and stroke are one of the leading causes of disease and death in Laotian Americans, and part of that is because of the self-management for disease versus getting checked out by a primary care physician. Language barriers are another nursing concern because most Laotian Americans speak little to no English, and most of the providers speak no Laotian. So we have to rely on translators or translating software, which you can lose something in translation if the communication is not quite as coherent and natural when you're using a program or going through a third person. Next we're going to have Grace speak to you.
Okay, for our last section, I'm going to be talking about promoting health, preventing disease, and overcoming barriers. So first step would be to making ourselves more culturally aware. So knowing about their health-seeking behaviors, so they're more likely to consult family, friends, or even neighbors before medical professionals. They are also starting to take a more integrative approach where they do seek traditional treatments for smaller ailments, but are starting to see Western medicine for more chronic conditions. And next, knowing about their cultural background. So a lot of them are refugees and they've experienced trauma, torture, or physical injury, and they are found to have higher rates of chronic diseases due to these experiences, and also some mental health issues. And then just knowing about their diet, as Nii talked about earlier, is gonna help you give more tailored nutritional advice. And then their collectivist culture means that elders and youth may be present or involved in patient care, so involve them in patient education as well. Moving on to their health education, I think screenings and vaccines are going to be very important. Asian American women, among all ethnic groups, have the lowest rates of cervical screenings, and as Lonnie mentioned, hepatitis B vaccines are lower than the general US population, and liver cancer is higher than the US population. So addressing screenings and vaccines is going to do a lot of good there. Then encouraging their helpful practices, such as their diet, which is traditionally quite healthy, and then just acknowledging and being aware of their more spiritual practices, which are not typically non-harmful. And then, as I mentioned, giving nutrition advice that is more specific to their diet. And finally, overcoming barriers. So the barriers most commonly found are financial, transportation, language barriers, mistrust, and just being unfamiliar with disease process and disease prevention. So first, we propose health fairs and health outreach at cultural centers and cultural events here in the community in St. Pete. Then partnering with cultural and community leaders, as they did in a 2020 initiative to promote more cervical screenings. And what this does is build more trust between their community and Western medicine, and also promote word of mouth recommendations for things like screenings, vaccines, and seeing their healthcare providers. Finally, to address the language issue and the lack of trust because there are not many Laotian healthcare providers, we propose a volunteering of Laotian medical students and nurses that are local to the community, and they can help with translating, they can help with filling out forms if they don't read or write, and they can just help with attending visits to make patients more comfortable. And that concludes our presentation on Laos.